Welcome back to Voices in the Health and Wellness podcast, where we explore honest conversations with practitioners and innovators who are redefining what care looks like today. Today, I'm joined by Dr. Sarah Secor-Jones, an integrative and functional medicine physician and the founder of Lesh Lifestyle. Sarah has carved out a powerful niche working with neurodivergent women in midlife, an often overlooked group who are frequently misdiagnosed or underserved by conventional healthcare systems. Drawing on her background in emergency and military medicine, she now takes a deeply personalised root cause approach, focusing on hormones, mitochondrial health, and neurotransmitter balance to deliver meaningful, lasting results. Alongside her clinical work, Sarah has rapidly grown a global audience through her Substack, Neurodivergent Women in Midlife, reaching thousands of readers in just a few months and helping translate complex functional medicine concepts into practical insights. So with that, Sarah, I'd love to welcome you to the show. Thank you so much for joining us today.
Yes, thank you so much for having me. I'm very excited.
So would you mind starting out by just sharing a little bit about your background and your journey and how you ended up focusing specifically on neurodivergent women in midlife?
Yes, absolutely. So as you mentioned, and thank you for that wonderful introduction, I just actually retired after 25 years of military medicine last month. So yay to that. But my love actually and passion for integrative medicine started actually in the military. So people would think, oh, you're an emergency medicine doctor. This is kind of an odd path. I would argue actually it's pretty darn aligned. And this started when I was in, Iraq, and you're seeing people on the battlefield. I can, save your leg. I can do a crike on you. I can put in a chest tube. I can save your life in that moment. But when we kept going back to garrison, I was like, there is so much more that is missing. We really should be supporting, these soldiers, sailors, airmen, Marines, like before. And what are we doing after? We're not supporting the body and on the cellular level. And so that is really where my love from an integrative medicine standpoint came. And then from the neurodivergent realm, I am neurodivergent. So one of the most powerful, times in my life is actually coming back from war and realizing that my neurodivergent skills that actually made me phenomenal in that situation, right? Where there's lots of urgency, lots of demand, didn't really serve me as well after. And also nobody cared. And I don't mean that meanly, but everybody just thought I was this amazing, capable person. And nobody was looking to see if I was okay. Right. And so I realized, and then as I became 40 and hormones and things like that, I realized like, holy cow, there is this whole segment of women. We're doing better talking about women in midlife and hormones and, mitochondrial health and longevity. We're doing better. We're not there yet, but we're doing better. But then I was like, no one is talking about the neurodivergent women, right? Or those that identify female at birth. And what we go through and how our hormones and things change us, because we already suffer, right, for a lot of our life, right? 8% of women have PMDD. 40% of those have a neurodivergent diagnosis. So we're already experiencing hormonal changes and differences since the day we get our menstrual cycle. And we've been overlooked for a long period of time. And so then when we add in midlife, and we lose estrogen, progesterone, and, we've been losing testosterone, since our 20s, things can really fall apart. And I don't want to take away what happens to neurotypical women because midlife is terrible too, right? The statistic for us is 90% of women will experience perimenopausal symptoms. There's that amazing 10% who get to fly through it, and kudos to them. Maybe we should do some genetic testing and see what they have in their blood. But 90% of us will have some sort of symptomatology. And then when we add on neurodivergence on top of that, we've already been struggling from a dopamine, prefrontal cortex, type of things our whole life. And then we add in, losing estrogen, progesterone, our GABA, and then it can really be, quite a storm. So that was a long way to say how I got here.
No, thank you. I always appreciate the background and context, really helpful. So with that then, what are clinicians missing most commonly when they treat this group in your experience?
I think it's putting it all together. So what I end up seeing is they're getting a lot of good psychological care, right? So they're on stimulants or mood stabilizers, because we also see, neurodivergence isn't just ADHD, it's autism. And interestingly, the autistic women are usually misdiagnosed with a mood disorder sometime in their life before it's actually come out that it may actually be autism. And as you know, autism is a spectrum. So, but what I usually see is they are usually getting that care, and life has forced them that way. But nobody is looking at the other piece, which is, hey, what does their mitochondria look like? How are they detoxing, right? What is their hormonal optimization? And then the opposite is that's true. So then if they are getting care from a hormonal standpoint, our practitioners aren't understanding that neurodivergent women are actually more difficult to treat. They're very sensitive. So even typical 0.25, our lowest estradiol patch or gel that we have here in the US, that actually may be too much initially for a neurodivergent woman. So understanding how their treatment can be different, and that the standardized, hormonal therapy that we have may not actually work for them, or we may need to personalize it and not be like, okay, you're just going to try this dose because of the sensitivity. The other piece is we are very, very sensitive to progesterone. And there's an interesting phenomenon where sometimes we don't like the 100 or 200 milligrams that we have here. It actually creates a little instability because we're getting a little bit of activation of GABA, but we're not saturating the receptors. And so they will not like it at all. But interestingly enough, if you go to 400 and saturate those receptors, they will actually do well. Because it feels more stable in the body. And it's that stability of hormonal changes that the neurodivergent brain doesn't like as well. So a lot of practitioners or providers don't know that, right? So it's like, oh, they can't take progesterone, or I don't know, what to do. But there is things we can do. We can change their, dose or their method or their route. And so a lot of them, if they are even getting treated, will end up in this position where it's like, I can't take hormone therapy because it doesn't work for me. When really, from a provider standpoint, it's just that we have to understand the neurodivergent lens and their systems and sensitivities.
This is really fascinating. And I think you mentioned before that, using your words, standard approaches can backfire. And is that what you're referring to now with, the dosing and the differential response of these patients?
Yeah. And as you know, personalized medicine is really where things need to be. Everybody doesn't respond to the same thing, nor should they. Everybody's system is different. But also understanding that the conventional approach or the standardized dosing that we have, right? So for here in the US, your lowest dose is 0.25, and then we start them usually on 100 of oral micronized progesterone. That's kind of like the standard, what I would say a standard dosing would be. So understanding that may not be, okay, or they may need some adjustment. And then also looking at the rest of the system, right? So you said my buzzword, which is mitochondrial health, but, mitochondria, I said, are the longevity, they're the longevity word of 2026, because mitochondrial health is so powerful. And, as in women, we are the most mitochondrial dense in the ovary and the brain. So even optimizing someone's mitochondrial health by 10% can have significant improvement on, their overall quality of life.
Thank you. So tell us a little bit about your current practice / lifestyle. What does a typical patient journey look like? How might it differ from patients who have experienced traditional care?
Yeah, so we're a physician-led, precision-guided medicine business. And to be honest, I'm really in the business of bringing back relationship-based medicine. So I tell this to my clients all of the time. I think health and longevity work really well when you have a relationship, right? So here in the US, we're very, medical care has gotten very transactional based, right? And it's unfortunate, and I have amazing colleagues, and it just stinks that that's what's happening. But you get 7 minutes, you're in and out, you don't really talk. It's like, okay, you have this, okay, do that, okay, do this. So here at Lash, what I'm really trying to develop is exactly the opposite of that. It's relationship-based medicine. They come in, it's, their first visit's an hour. Same thing with our follow-ups. They're 30, 45 minutes, really whatever time the patients need. They have direct access to me on a chat, which, I check every day in the morning before clinic and then after. So they don't go, would never go more than 12 hours unless it's a Friday night without hearing from me, which is, I think, so important, because a lot of the things that is missed is just people feeling heard and understanding that they have a place or a person to be able to bounce the questions off. And I see this a lot, especially from a hormonal standpoint, but even when we're doing a lot of mitochondrial work or we're doing a lot of gut work, as these treatments they can cause symptoms, right? And they can cause, different things. So patients, if you see them and then say, okay, I'll see you in 3 months, if we're working on this level, a lot of times I would find that they would stop doing something. They're like, oh, 2 weeks in, I had this symptom and I quit. Well, if we had this relationship and you messaged me and we talked, we could get them to get through that initial piece, right? And onto the treatment that really can stabilize them. So that's what we try to do here. What I try to do every day is establish relationships with my clients. I think of old school medicine in the US, like my grandmother used to watch the Hallmark Channel. And back there in the day, I remember all of these movies where it was this small community farm country with this doctor who knew everybody. And, he knew your cow's name and your horse's name and your auntie and everybody. And that's what I envisioned. Sarasota is not a small town, but that is the presence that we are trying to have here, where, we're a small town doc, like my husband is also the nurse manager. And currently our 15-year-old is actually interning here for the summer. So we try to create that family based practice.
Lovely. Do you think awareness of neurodivergence is catching up clinically, or do you think we're still lagging behind?
I think that it's catching up a little bit, kind of like the women's health thing, where we're getting more awareness to neurodivergence. Patients are getting more diagnoses of neurodivergence. What I think, though, is we're lagging behind on what exactly does that mean and what do we do about it, right? So a lot of women, and I see this on Substack quite a bit, amazing community of women, but they'll get a diagnosis or they're looking for a diagnosis, but they get it. And then it's like, okay, what does this mean, right? What does this mean? And we're not doing a great job of helping. So for example, a late diagnosed woman, which we see a lot in midlife, and it's catching up because we're actually diagnosing them now. But a late diagnosed woman, it's not like everyone thinks you get this diagnosis and then it's like this beautiful thing. The actually healing starts the day you get the diagnosis, and it can be a pretty treacherous path. Imagine like masking your entire life and getting this diagnosis now, and you look back, there's a whole system of grief that happens, right? It's like, oh my gosh, why didn't anyone see it? Why did these people fail me? I failed myself. I should, we eventually get to a good place, but we're diagnosing more, but I feel like the support is still lacking with, okay, now you have the diagnosis. What do we do with that? And how do we navigate it?
Thank you. So thinking about your work from a business perspective, you're a relatively new business. What are you most proud of so far? What's going really well for you? Obviously, you've got a model which you're very proud of in terms of the more sort of patient-focused and the personalized touch. But what else about the business is something you're proud of?
I get to do this, maybe is a little bit more on me than the place, but I get to practice medicine how I want to. And that is really powerful for me because, being in military medicine and also in corporate medicine, I never, even though I was saving people's lives, right? Like we in emergency medicine, like we've done, we do some crazy things, right? And save 7-day-olds and all this like cool stuff. I never actually really felt satisfied as a physician. And as you know, as a physician, we put in a lot of work and dedication and time to get here. And I think that is probably one of the biggest things, besides creating a community, being a staple in the community where people know and can trust me. I finally, for the first time in my career, feel professionally satisfied. Like I am making an impact, but also that I am practicing medicine the way that I want to and that I've always wanted to. So I think that's the most powerful thing for me right now.
And in the transition from, military medicine to this new venture of yours, what's, in terms of challenges and bottlenecks, what are most impactful in your business right now? Or what are some of the things you've had to overcome to do what you do?
Well, I don't know about you, but as a physician, I was not really given any business education. Actually, none, to tell you the truth, which I think is actually a disservice. And I do teach residents, so we are working on that, at least giving them some exposure to a business plan. But I think that was my biggest thing. And I think I would assume that that's what holds up a lot of my colleagues, right? Is like starting your own business is scary. And it is scary. I'm scared every day still, right? I'm growing this thing and I'm passionate about it and I feel really good about it. But I've had to teach myself everything. Like I taught myself how to use a CRM and make ads and all this stuff that I knew nothing about. I know medicine, and that part of it, I'm like, okay, I can do that. But as a business owner, it's scary. And also it's different. Who you are, what you do, has to portray out, but you also have to have the business sense behind it. And so, I always say you just keep doing it until it goes, you're just doing the things. But for me, the challenge has just really been learning the business side and also figuring out how you do that, right? As physicians, we want to give and give and give because we care so deeply, but you can't give and give and give if the business isn't successful, right? So there's two things. And I think I finally turned the corner with that and realized like, I want to give free healthcare to everyone. That's what I want to do. But I can do those types of things once I've grown my business to where it needs to be. And I can start giving back and I can treat people for free. And but I have to get my business piece there. So that's been the most difficult for me being a physician entrepreneur.
Thank you, really helpful. And I think a lot of people resonate with that, including myself. Mm-hmm. So where are you looking to take this going forward? You mentioned about scaling and growing it. Where would you like it to be in, say, the next 12 months and beyond?
Yeah, I say my mission in life, I kind of have two. One, obviously, is my personal practice here and, teaching. It's actually three because it's a personal practice here. I can affect the patients that I can affect. But also I didn't create a business where I can scale that infinitely. And the reason is that I believe so wholeheartedly in who I am, what I do, and how I practice. I don't know that I could teach that to someone else. So my private practice will cap eventually and at a comfortable goal where I can still give everything I want to give to my patients because I don't want to become transactional. I don't want to have this big, 5,000 patient panel where I don't know people. That's not actually the model that I built. So I want to personally impact my patients, but also, which is why I started the Substack and why I do YouTube and things like that, is I believe that whether someone could be my patient or not, everyone deserves to understand what health and longevity look like and what is possible and what they deserve from a healthcare system. And so I want to be able to teach that and give that forward because I can reach a lot more people in that realm than obviously I can in my private practice. So that in 12 months, that piece is really what I'm looking to grow and do and help people navigate a system that may not be as ideal. And I truly believe, at least in the United States, that patients will be able to change healthcare faster than us doctors can. And trust me, we are trying, right? We are trying to navigate the systems. And we have a whole amazing longevity docs group where we have cardiovascular surgeons and neurosurgeons and GI and urology and OB and primary and all of us who are like, listen, we don't want to do it this way. We want to do it this way. But medicine's hard to change, right? And so I believe that if we empower patients and we educate them and we arm them with the knowledge and the things that they deserve, they can actually help us move the mark faster. Because if the patients demand it, the system is going to be forced to change faster. And then, of course, the last piece of that is training the new doctors coming about a different way, right? And just not that we have to change the training that they're getting, but really just showing them that there is a different way, and we need to think about things as a whole person and not, we're seeing them maybe in the hospital for a stroke, but, is that woman, or we're seeing her, I'll give a better example. We're seeing this little old lady for a UTI and a hip fracture, right? Is she on vaginal estrogen? Right? Would it have prevented the UTI? Thinking about those types of things, and just trying to teach them to have a little bit of a wider view, and giving them a little bit of like business knowledge. So if they ever decide to venture off, they're not coming to us 10 years, 15 years from now and saying, nobody ever taught me anything about business. I hope that they'll be like, Dr. Sarah made me do a business plan, So those are those are my goals.
Thank you. So you've obviously crafted this niche. I suppose I'm going to say it's specific rather than narrow, because I imagine there's a large number of women that fit into this category. What works from a marketing perspective in terms of reaching and messaging your kind of target clients? What have you discovered?
So what I've discovered is what works the best is being honest and calling things what they are. And I don't mean that in a derogatory way. The reason that my Substack has been so successful so quickly is this niche, but it's because women want to be heard and they want to be validated. And then not only that, but it's like, okay, that next step, what do we do about it? Right? Like, okay, great. I have PMDD. Great. I just got diagnosed with autism. Great. I have ADHD. Where do I go? So putting that science behind that, I think is really powerful, and saying, look, this is what's actually happening in the brain. This is actually why you have PMDD, right? All of this makes sense. And these are the things that need to be done. And it's really that true calling out. I feel, at least, that the neurodivergent community, from a marketing standpoint, and I'm assuming, women in general, it is that piece. It's calling a spade and saying, okay, here it is. What do we do about it? And I was just listening to another podcast, and a gentleman was on, and he kind of blew up internationally because what would he do? He actually put a wig on and pretended he was his perimenopausal wife. He's a comedian. And he was saying like funny things that she would say. And all of these women started messaging him, right? And I think that piece of it's true. It's saying what the issue is, right? And then taking it to that next level of okay, now that we've named it, what do we actually do about it?
Thank you. So your Substack growth is very impressive. For those that don't know a huge about it as a channel, how does it compare to other kind of social media channels? Why have you chosen this one in particular, and why do you think it is so successful?
Thank you for asking me this, because I'm actually, I don't know about you, but I really don't love social media. I do it from a business owner perspective because we have to. And I'm kind of a fun person. I'm not really boring. So Instagram is okay, but I don't love chasing after something, right? It's like, oh, you have to get these. So I actually went on Substack because I was told by a publicist that in 2026, if you want to write a book, you have to have a growing Substack. So I said, okay. So Substack is it's been an amazing experience to me because I can actually be my real authentic self. I don't have to do silly videos. I don't have to make crazy hooks. I can literally talk about what I'm passionate about, who I am. And I talk about who I am too. I did a piece, one of my first pieces was actually about my neurodivergence and being a neurodivergent, doctor coming back from war and what that looked like for me. That's why Substack for me is so powerful, because in my realm, I can be who I am and I can talk to the audience that I want to, just about real life stuff, things that are actually happening. And I don't have to make it pretty or do this. It's just really raw and what it is. And I didn't know if it was going to stick or not, right? I just said, you know what? I'm going to go on here. And then it felt good. The community felt good. People, now there's still trolls out there, don't get me wrong. But for the most part, Substack is a very, very warm community. People that want to read your stuff are going to, and the people that don't typically, just scroll by. There's not a lot of, I've on Instagram and stuff, they think your glasses are so ugly, I would never take you seriously. And it's like, okay, then don't take me seriously. What? I don't even know what my glasses have anything to do with this, but that is not really the community on Substack. You get to be your true authentic self and write, what you want to from a physician standpoint.
Thank you. Really helpful background information, because it's not hugely talked about over here, and it's useful to hear your perspective and how you've managed to make a success of it. So thank you for that. So with all the hats that you're wearing at the moment in growing, developing the business, as well as doing the treatment and seeing the patients, what is your biggest time drain that you perhaps resent or don't enjoy quite so much in all the things that you have to do?
It's definitely the business side. It's definitely the oh, we got to run these ads and our CRM. And if I could just give that away, I can't afford to do that right now. But if I could, they say in business, you pay with your time or pay with your money, right? We're still growing, so we're paying with our time. But that would really be it. I would love to just be able to focus on treating the patients, doing, educating the patients, teaching the residents, and have someone else be working on this whole ecosystem behind. Oh, how does your Instagram go? How does this go? If I could hire someone or a team to have all of that taken away from me, that's really where the time goes. And it's also because I don't enjoy that, right? So I enjoy talking with my patients. I could talk to and it's also part of my neurodivergence. So I could talk to my patients for 2 hours and not be drained. But if you want me to go on a meeting about marketing, I'm 5 minutes in and I'm not paying attention, right? My ADHD is like squirrel, because I don't have a dopamine from that. I don't want to do that. I know I have to. So as a business owner, that is the piece. If I could just be Dr. Sarah and do all the things Dr. Sarah does, I would be so happy. That would be my dream.
And what's the thing that keeps you up at night? I mean, you obviously mentioned the business side of things is the ongoing challenge, but is there anything specific that kind of keeps you up at night or makes you wake up?
Nothing really, I don't wake up anymore. That happened to me a lot in emergency medicine, right? Where I'd be like, I think more it's me, my brain always thinking about, are we doing enough? Am I doing enough for the community? Am I helping that person enough? And, or what, complicated patients. I love complicated patients, but that's what keeps me up. And I'm like, well, what's going on? And why isn't she responding? And what is happening here? And how can I get that down? And what else can I learn? And, that piece of it, that ever revolving, I want to make sure that we're giving the best care to everyone because they deserve it, number one. But also because that is how I am as a physician and how my brain works. And so the business side keeps me up sometimes too, right? It's we got to be able to keep the doors open to help people. But also I think that ever revolving, piece. One of the other things is that, and I don't have too much of this, but a lot of the patients don't just see me as a physician. So they may be seeing a conventional medicine physician, and sometimes there's a lot of discrepancy. And that can be very frustrating, because they're like, oh, well, I went and they put me on this, drug. And I'm like, well, that's not the right drug. That's inhibiting your mitochondria. You're already on these drugs. So also that back and forth with my more traditional medicine colleagues, I wish we could be a little bit more collaborative. That piece is also something that kind of drains me and keeps me up.
I hear you. You've mentioned team members. I was just wondering what your approach has been to building a team in terms of getting the right people to work in this space with you.
So it's been tough, actually. I don't know about your experience, but I've had not that work in the practice, but I'm more from a business side. I've had quite a few different experiences that were not great or ideal. And now I think that my approach is you really have to fit the bill of what we do here and what my mission is. And I just actually brought on another team member for doing, my PR and outreach. We have also some amazing technology here in the office. We do have TMS and things that we're doing. So we're working with some veterans, and we're about to launch because, June is Mental Health Awareness Month and PTSD. We're about to, do some nominations for a veteran to come in and get some treatment. And so I had hired a PR girl who is really, really amazing. But the process of her and I working together, was pretty rigorous, and that is what I think from a business owner perspective is we shouldn't be just hiring the next person or the person. We really need to make sure that they fit in with our business and who we are, and that we're, giving them the right job for what their skills are and who they are, because that's what's going to make us most successful. We can't run the ship on our own completely. But also from a business owner perspective, hiring the wrong people can be really, really detrimental as well. So I think we just can't hire whoever from a job description. I think we have to really, as business owners, understand what we're looking for, what are those qualities, and then make sure those people fit the bill.
Thank you. Now, I don't know how big this market is, and I don't know how many people, what your capacity is, but I just wonder whether you've ever thought about scaling beyond the one-to-one model. Would this work for group programs or to digital education at all, or is this very much a one-to-one driven kind of model that you want to operate?
No, I think that you bring up a really good point. I think the educational piece and the baseline foundational pieces do very well in group settings, and from a digital standpoint of like, how do you learn? Like I do have a course that's the biology of the neurodivergent brain, which is, I did it actually on Substack as a 6-week course. And then so I just put it on my Dr. Sarah website to get the baseline knowledge and kind of understanding of where things go. I would say 85% of things can be done that way. The 15% really comes to that individualized person and working with them as an individual. If you're going to be, optimizing hormones and all of those things, that has to be on a personalized level. The educational piece and filling that knowledge gap of, okay, now you have a diagnosis, now what? Definitely can be done on a group basis.
Thank you. If you had your time again and you were starting this all again tomorrow, would you do anything differently?
I would have started a long time ago. I definitely would have started a lot sooner, and a lot different from a business perspective, not from a medicine perspective though, but I would probably have started it 10 years sooner if I could do it all over again.
With that, Sarah, I'd love to thank you so much for joining us today. It's been really interesting hearing your insights into this particular niche, very interesting, but also the other aspects of the clinic, the business side of things, and the things that keep you up at night and the things that you're working on. I think it's been really fascinating and very insightful. So thank you so much for joining us today. Really appreciate it.
Thank you so much for having me. I appreciate you.